probably the easiest thing to do when you find, which they did, spermatocords. There's two spermatocords there. I can see them both, right? There's central, we can do a central separation, but the best way to to dissect the testes out is to go in like this and just kind of slowly separate them from the skin, and you can see that they will pop out eventually, right? So, see if we can get the back side here separated. So they're relatively, this is a small cat, so relatively small testes, but now we've got one separated out. We'll leave it kind of attached there, but so this is the spermatocord, that's a testes, or that's a testicle right there. As we go up in, I don't know if they've done any damage, and I'm not saying they did or didn't, but sometimes you get these structures cut. In fact, I think I can see maybe one right there. So here's the bladder, and these are those saddlebags we talked about, right? See those right there? One there, saddlebags. I'm seeing, hopefully I'm seeing vas right there. So what you want to do, this is all, hard to tell exactly what we've got here, but part of this was abdominal wall. See it right there? Abdominal wall. So I'm going to go through this direction and hopefully not cut it, but I can see spermatocord. Remember, it's really important to use reverse scissor technique because you're trying to separate out, little thin structures from much larger structures. And I can see the vas deferens right there. See it coming in the back side? So we can remove these little dudes, as I said before, the little saddlebags. There's blood vessels I'm going to remove here too, but I want to get this out of here so we can see what we need to see. Be careful I don't cut that vessel. There's a vessel along the back side of that I want to keep intact. Okay, so now I want to go down a little bit further into the abdominal wall, get some of this stuff off of there.
Professor, has the bone already been cut?
Not on this one, no. So I'm just following the structures that I can see. That's muscle right there. That's fat right there. So I remove that. Now what you have, you can see this is spermatocord, and we've cut through the abdominal wall right about here. So that's where the inguinal ligament would have been. Remember, this is abdominal wall right there. The inguinal canal, it's going to be right about there. So spermatocord, as we get through the abdominal wall, as I said before, the vas deferens will separate off. So that's vas deferens there. Here's gonadal artery right here. You can see it right there, right? It's going to travel up inside the abdominal cavity. This is ureter. No, that's not ureter, is it? Yeah, that's ureter. That should be the ureter right there if we follow that up. Either that or if it's going to the vessels, then it's just what we call a vesicular artery. It still might be. Where's your ureter? Maybe it's already been cut. I can't tell yet. But anyway, this is the spermatocord. These are the arteries. So this should be testicular artery in here, but it's actually going, it's interesting, that's not where it usually goes. The testicular artery should usually enter up in here. In fact, this looks to me to be a testicular artery, but I don't know yet. No, it's not. That could be superior mesenteric, I just can't tell. But this is definitely spermatocord on or vas deferens on the left side, and then you can see the other one on the other side. It's right. Come on now. It's that dude right there. So then this is going to be, now that should be ureter. The other one should be right there. That's it. That's ureter on that other side. So you can see the little tube? If I can get that separated. See that tube right there? I'm lifting up. That's the other ureter. So ureter here, ureter here. That's deferens. Spermatocord is down here. So to see the other stuff, we need to kind of get through this to get them separated from each other. So I'm going to go down in and get this testicle separated. On some of the bigger cats, like I said, this is a very small, young male. If you find some of the bigger toms, it's going to be a lot more fat or a lot more fascia. This dissection will be much harder to do. So I'm going to separate it. We want to get it out of this little the pocket of the scrotal sac. And then what you're going to do is you'll make your cut. So now we know we've got the important stuff saved. I can come in here and just start getting through the muscle. Because remember, I said you got to kind of have to cut the muscle first. Because then you're going to see the penis come through. In fact, this should be part of it right here. Okay? Because that's going to the outside of the body. So that should be the penis. And what we want to do is kind of follow that up and in. But as I said before, you want to get rid of all this muscle first. Let's not cut the penis. We want to get rid of some of this muscle. Then we can start doing the cut with the Rogniers. But I would recommend you come in from above. So that way you don't tear the, because you can see there's the ureter, urethra's right here. See the urethra right there? Urethra right there. Okay. So we want to kind of go in this way from the top, not cutting the spermatocord. I can separate these two. Let me just do that real quickly so we can keep them away from each other. And then come down here, and then you're just going to, like I said, with the scissors, you can cut this muscle out of the way. Anybody have the Rogniers? Want to grab a pair real quick? Don't do this before, but you know what you've got. You can kind of start up in here. And it's best if you kind of, you might even feel the cracking or breaking of the, when you do, even just pushing it apart. But you're going to do your cuts like this. And slowly work your way down until you, but remember, as I said before, you can use scissors to kind of cut this out, but just go slowly. It's not going to be cut, 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 everything's gone and done. Cut a little slowly, remove some of it, and then go a little further.